Well, welcome everybody. And tonight's topic is going to be pet longevity. Longevity is a very popular topic these days. There's billionaires spending tons of money trying to live forever. I don't think you have to spend $1 billion to live forever. You just have to kind of know what things to do and what things not to do. And I gave a lecture on this topic to veterinarians back last fall, and so I borrowed a few of the slides from that lecture to kind of talk you through kind of what longevity is and how we do it. So and got some very practical suggestions, and then we've been able to finally get connected to the different partners that provide those different foods. So I want to talk about them a little more. We've Our animals have tried all of them, so I've had personal experience with them. And then we've got a new idea. We've got these bundles, and so we're going to introduce the bundle concept to you, which is where you can buy two items and get a pretty substantial discount for that. So in this day and age when prices are escalating and everyone's pocketbook is very sensitive, hopefully these will be a good thing. Um, so let me get rid of this. Meeting controls. There we go. Okay. So yeah, so we'll get started. And so I'm gonna have Haley read this first part. Okay.
Yeah.
Okay. And then I'll do the disclaimer and then we'll get to the next slide. These are the same slides you've seen every time because it's worth not, we can't be sure everybody has been here before. And anyway, so why don't you go get started?
All right. So today's topic is longevity strategies for our four-legged friends. And here is some housekeeping information for today. We have questions from email that we will use first. You can put your questions into the Q&A Zoom meeting function or the chat. And we do plan on answering all of the questions, no matter how long it takes. We'll see if there are common threads to questions. For instance, when the same question is being asked by several people, these questions have first priority. And then feel free to raise your hand if you are understanding what is being said. We definitely want everyone to learn and benefit from this time together.
And I just have to say that as much as I want to be able to help your pet's specific problem, because we don't have a doctor-patient relationship, things are kind of remote, don't have all the information I don't want to give the wrong advice or whatever. So basically tonight I'm not giving medical advice, but we're going to be educating you about the questions that you're asking, be medical education. And I'll do my best. But if you need to ask me that, if you need more information than I'm able to give tonight because of FDA constraints and everything else, then personal one-on-one email would be a good place to begin. And you've got my email address is almost everywhere. I've got it somewhere on the next slide, I think. Let me see. Yeah, there it is. The best email address to reach me at is questions@wellpethelp.com. I'm on that all the time. It will get to me. And we're doing these the fourth Thursday of each month, generally. We do record them live, and so there will be replays available. And they are posted on our YouTube channel. Might take a day or two to get there. The book I've written, I don't have it up there. There's a mushroom for that, is basically the reference text, although I haven't really been referring to it. And if you wanted to order the book through Amazon and send us your Amazon receipt, we're happy to send you a discount coupon of 25% for 2 times for anything on our website. So that's a pretty good deal. And after a year on Amazon, I've lowered the price on the book to $25 from 35. So, and I'm also considering, although I don't have a lot of bandwidth to do this, adding a second live event a month. And that would be more of a mentoring event. That would be free. I'm still trying to figure out how to charge for the stuff, but for now, your support of our products on the website are, in my opinion, compensation enough for my advice. But I was thinking about doing mentoring in which, I would have a specific topic, so all the people whose pets need information about that topic. Let's say allergies, let's say, mobility, let's say, I mean, what diarrhea, or, chronic digestive issues or cancer or things like that, we would just cover a single topic. But for me, the idea would be to have multiple people ask questions, and then my answers would be kind of more applicable to everyone there, at least in a more general sense, which for me, I'm just trying to, there's just, I'm so overcommitted with my time. At the same time, I think this is a really important thing for me to do. I'm just trying to figure out how to get the work-life balance where I can provide this information and at the same time, have a couple of days off from now and again. Anyway, so that's our introductory stuff. And so today we're going to talk about what does longevity look like in our four-legged family members. And then we're going to present you with some strategies that have been shown through scientific evidence, because I don't just throw things up. I always want to know that there's a study somewhere that supports what I'm saying. So strategies to promote a long and healthy life, because I've become kind of the mushroom guy. A lot of the work I've done has been focused on the value that mushrooms have in terms of establishing and helping with longevity. They're not the only thing to use, but they have a lot of value as a single supplement, and they can be very easy to use, and cost effective as well. So we'll answer the question, do mushrooms promote longevity? The answer is yes. And then we'll talk about the microbiome. The microbiome has been an area of great interest for me, and I am rapidly learning a lot of information about it because as a veterinarian, and especially as a holistic veterinarian, I've always been trying to find that one thing or those couple of things that are at the root of diseases. What really causes the disease? We don't want to just treat symptoms. We want to go to the source that caused the disease and alter that so we have a permanent cure, a permanent fix. And it turns out that the microbiome, the gut microbiome, the skin microbiome, the oral microbiome, the eye microbiome, the nasal, all of them, which are collections of bacteria and other organisms that work with our immune system to promote greater health, turns out that really is, I think, the source of all of these problems. And so that's why I'm trying to get more knowledgeable about it. And there's the high end, the big strategy that they're doing to improve the microbiome these days is what they call fecal transplants, which is where you take the feces from a dog who is healthy, and not just a healthy dog, but you want to do testing and know, what its genetics are, and and test its microbiome as well. And we take that stool and um, we administer it to another dog through a retention enema. We have a big syringe and we kind of push it in there. But there's other things that we do that also support the microbiome, because that's a pretty extreme thing, although it's not that dangerous and not that hard to do. But there's other things like mushrooms themselves promote a healthy microbiome. They serve as prebiotics. The diet that you eat, the diet that your dog eats, all can promote a healthier microbiome. That's why I put such a strong emphasis, and why so many people put such a strong emphasis on diet. It's not just about the nutrients, it's about how the nutrients um, are work in the body. And for instance, one thing we've discovered is that diets that are high in carbohydrates tend to be pro-inflammatory, which means that they actually alter the microbiome in a way that it starts to becoming pro-inflammatory. And so by that, and that's one reason why you hear so many people saying, we need to feed less carbohydrates, because carbohydrates do fuel inflammation. They're not bad. You have to use the right, you don't want to use a lot of them. They're okay to have some of them. But, when you're looking at things like commercial kibble, highly processed, ultra processed food that is at least 50% carbs that are processed, the molecular structure gets changed from the processing. That may be too much, in these commercial kibbles to promote a healthy microbiome. So we want to look at high fiber. Fiber are prebiotics that feed the microbiome. Protein is good, but and moderate high protein, low carbs. Mushrooms are great if you cook them, um, and moderate to high quality fats, healthy fats like medium chain triglycerides and the fish oils, EPA and DHA, and omega-3 alpha linolenic acid from flax. These are all really healthy oils, and I suggest that we try to get a little bit of each, every day into your critter because these are really healthy fats. Things like coconut oil, fish oil, or krill meal, flaxseed meal, chia seeds. These are good whole food sources for these. And really the best type of food is a whole food as compared to something that's been processed, isolated in order to give you a larger amount. So you don't have to take as much, but it's better in a food kind of source. And then, healthy lifestyle, minimal use of drugs. Drugs are sometimes, necessary evils we have to use in order to treat nasty diseases, but using them properly and minimizing their use is the way to go. I was just looking at a bunch of studies today about the bad influence that antibiotics have on the microbiome and how just the use of probiotics and things that improve the microbiome helps the body to overcome that negativity of having had antibiotics. But a lot of people in the veterinary world and a lot of the teachers and the studies are suggesting that instead of treating things like upper respiratory disease or diarrhea, which are probably the most common problems we see in pets that need antibiotics, that we should look for other ways to treat these other than using antibiotics. Herbs are a good way. Mushrooms can be helpful. Acupuncture, there's lots of other ways of treating it. And many of these things are self-limiting anyway. Most diarrhea is self-limiting, especially if you can alter, the food they're eating. And upper respiratory can also be pretty self-limiting. There's good studies showing that the use of beta glucans, which is the primary immune modulator in mushrooms, actually reduces the incidence of upper respiratory diseases, in group homes where a lot people are living together and there's greater contagion from that. Anti-parasite drugs can be toxic. I know there was a question tonight about, what ticks. This is the season for ticks now, so we probably should talk about that a little bit and avoiding toxins. So just a healthy lifestyle is important in terms of longevity. And I want to make it clear that we don't really necessarily want to live a really long time if we're not healthy, if we're in pain, if we're suffering. So instead of talking about lifespan when we talk about longevity, what we really talk about is health span, which is the amount of time on this planet that we're healthy. And so when we talk about longevity, we're really talking about wellness. We've just taken that word wellness and we've kind of given it a new shine, because all of our wellness strategies all contribute to health span. They contribute to health and they contribute to a nice a length of health as well. So, what are some strategies let me get this up here. The strategies to promote health span. I kind of like this little, the road to longevity. It's a long and winding road, and there's a lot of stops on the way. You know, I'm going to sound like a broken record, but dietary changes and not just the same. We shouldn't all be on the same diet. Each animal, each person has a very unique and individual biochemistry and digestive system and genetics and everything else. And so there's a specific diet for that person and that animal that is best. Now it may be very similar to what someone else is eating, but really we try to tailor the diet to the individual. We want the diet to be as unprocessed as possible, but we also have to acknowledge that we all have budgets. And so, it may be that based on your budget, the best we can do is so and so as compared to a different budget. I mean, it's not a bad thing. Your pet will still do quite well with all the changes we're making. Things don't always have to be the gold standard. Things don't always have to be the best possible way in order for us to get positive changes. Daily exercise, is really important. There's one study I read that if you have cancer, and you can do like 150 minutes. That's basically 30 minutes, 5 days a week of exercise and mild exercise. That it substantially reduces the recurrence of cancer. Exercise is really good. There's studies that show that exercise improves the microbiome because it generates all kinds of positive molecules in the body. Certainly, we breathing fresh air, drinking clean water, these are necessities. However, today with global contamination, not often that easy to find. So do the best you can with where you are. And then, sometimes we forget that emotions have a really strong influence on health. And when you think about, and we saw this with the pandemic and all those pandemic puppies that, everyone had all this time to be at home with them. And then after the pandemic and people started leaving home to go to work, the animals were left at home in their apartment, and maybe in a very small area where they were stuck there all day long. And so that kind of brought up the topic of enriching your household environmentally, making it emotionally balanced and enriching it so that even while you're gone, your animal isn't sitting there bored and chewing its feet or being destructive in the household or whatever it might be doing. But in fact, it has some games to play. Maybe if there's a big TV with a video of birds or things that it's interested in, or some people will take Kongs and toys and stuff them with food and hide them all around the house like a game. So there's lots of ways that we can enrich the household for the pets that are being stuck at home while we have to go and earn enough money to pay for their food. And of course, emotionally balanced. We know that when there's anger, when there's sadness, when there's rage, these things are very emotionally toxic. And so we need to find a balance there as well. And then last but not least, and this is my area of expertise other than diet, are the appropriate supplements. And those would be, for the individual of constitution of that animal, just as we want to have the diet be tailored to the individual constitution. We also want these supplements to be appropriate for the individual constitution, of that pet. So, what are some of the health span supplement strategies? Well, antioxidants are really important because every day, our pets' bodies are being attacked by what we call the free radicals. And these aren't old 60 hippies. These free radicals are these ions that are created from normal metabolic function or might be caused by toxins, or there might be things in our atmosphere that we're exposed to. And these ionic compounds have these free ions can cause damage to tissues and can contribute to aging. And so by taking antioxidants in a moderate amount, you don't want to take really high doses of antioxidants unless you're being instructed to. But daily antioxidants can help to manage this damage, this aging process, from all these free radicals. We want the supplements to be microbiome supportive, and that's kind of the research I'm doing now that I was reading about today was what are the supplements that support different aspects of the microbiome, and certainly probiotics, prebiotics, postbiotics, food that supports a healthy microbiome instead of an inflammatory microbiome like I'm discussing. So these are things to think about. And maybe these are new concepts for you, and they were new for me just a year ago, and now it's really exciting. This new information that we're doing. You want to be able to promote healthy organ function and organ reserves, and there's many herbs that do that. For instance, everyone's very concerned about liver. Liver is probably the most modifiable organ in the body. It's most susceptible to improving itself if it's diseased. It can actually regenerate itself. They've been able to if you can cut a liver lobe off, they've been able to actually see that it can regrow. So there's things like milk thistle or silymarin, which in addition to helping the liver to better detoxify toxins, actually helps to promote improved liver function. Some people think that eating a healthy organ, like when you eat liver, raw liver or gently cooked, that there's special molecules in that liver which will actually help a diseased liver to become more healthy. That's called glandular therapy. and it's legitimate and it's real. So, if you have kidney issues, maybe eat a kidney. If you've got brain issues, eat a brain. So, but there are companies that that grow these and make them into supplements. So you don't necessarily have to be eating raw liver, and you can still get the benefit of the glandular. Training the immune system is really important to work optimally, and I can't think of anything better to do that than a mushroom. And we found that the beta glucans in mushrooms actually do train the immune system by if you take mushrooms long enough, it winds up teaching the immune system to be more reactive, to be more sensitive to immune system challenges. It's more vigilant. And so that's another important reason why mushrooms can be so valuable in terms of contributing to health span. We want to reduce inflammation, and using drugs to do that can also alter the microbiome, could have adverse effects on the liver and the kidneys. But there's a lot of herbs, there's a lot of nutraceuticals. Fish oil, fish oil is probably the most common nutraceutical that we know of. And there's great evidence that if you're using an appropriate dosage of the fish oil, it might take a little bit of time, but you can substantially reduce inflammation in the body. It might take as long as 3 months. And there's herbs like boswellia, and turmeric, and quercetin, which all help to reduce inflammation. And many mushrooms have anti-inflammatory activity as well. And then depending on what we're looking at, there are also specific evidence-based longevity supplements that can help to regenerate organ and age-related degeneration. In fact, there now are two drugs that have been FDA approved, two longevity drugs that have been FDA approved for pets. And one is rapamycin, if you've heard about that one. And then the other one is a drug that mimics insulin growth factor 1, which also contributes to longevity. So I think that lifestyle is a more important way to create longevity than taking a specific drug. But we kind of live in the age of drugs, and people would like to take a magic drug and live longer without having to do the work to get there. So I just want to show a couple of studies here, just to kind of give you that idea. Again, I'm the mushroom guy, so I hope you're interested in mushrooms. This was a study. It had 30,000 participants. It went from 2003 to 2014, and basically they examined the relationship between eating mushrooms and the risk of dying. And they call this all-cause mortality, which means you can die. They chart deaths from any reason. And what they found was that the mushroom consumption had a lower risk of mortality over taking no mushrooms. And then they added on several other studies. So instead of having 30,000 individuals, they had 600,000 individuals total, and that gave them enough because these epidemiological studies need a lot of subjects in order for them to develop any kind of statistical significance. And what they found here was the mushroom consumption was definitely associated with a lower risk of mortality than not eating mushrooms. So, there's some evidence for you. And this one's interesting. And, if you don't have cognitive health and you live a long time, is that really a successful life? I mean, I'm not being funny about it, but, health span would also imply that your cognitive function is also healthy. And this was really interesting. This was a study in UK of over 30,000 people, 40 to 92 years of age, and they showed that mushroom consumers had better cognitive performance than non-consumers in a number of tests, and they didn't take very much. They had 12 grams per day of fresh cooked mushrooms. 12 grams, it's like two mushrooms at the most. It's nothing. So it doesn't take much, and they're very potent. You need to cook mushrooms in order to, and they need to be cooked pretty well in order to get the benefits because they have such a fibrous cell wall that contains all the good stuff that it has to be disrupted through cooking. So, and this was 2024. This is a recent study. So, mushrooms, mushrooms. here's an interesting one in which they're looking at lion's mane. Everyone thinks about lion's mane for cognitive health, but lion's mane contains not just cognitive health ingredients, but also ingredients such as ergothioneine that has a benefit that reducing the rate of aging. It has a benefit for the mitochondrion and just in general helps to reduce damage to proteins and to DNA. So it's very protective, and so it's considered to be lion's mane is considered to be the longevity vitamin for that very reason. And it's called a vitamin because mammals, humans and animals both don't don't create their own ergo. They have to get it from eating mushrooms or eating plants that may have it in them as well. Um, and um, and so they have to eat it, ingest it to get in their system, but their body needs it. It's a conditionally essential nutrient. We have receptors for ergo all over our body, even though we don't create it ourselves. So that's why it's a vitamin, like vitamin D, for instance. Our bodies don't make vitamin D. Well, I guess unless we're exposed to sunlight, but they don't make vitamin D. And if we don't get enough vitamin D, then we get a deficiency disease called rickets. With lion's mane, the deficiency disease isn't as clear, but we certainly can see cognitive issues with low um, ergo levels. And so in this study, they used two different animals. They used mice and they used worms, nematodes, and they were given this ergo, which was derived from lion's mane. And in the mice, they started at 7 weeks of age until their death, and mice only live a couple of years, so it was fairly easy to follow them. And what they found was that the lifespan was extended. The benefits were seen even when they were in the very end of their age, they still had reduced frailty measurements. They still were much stronger. And so here you can see, um, you know, with without the lion's mane, they had a decrease in their mobility, they had increased oxidative stress, they had increased frailty. But with the lion's mane, they had decreases in all of these, and they had what we call healthy aging. Um, so let's go to the next one. So let me talk a little bit about ergothioneine because it really, in my opinion, it really is probably the single most important new thing to supplement that we've become aware of. Even though it was discovered in 1909, it's taken that long for us to figure out about it. So ergothioneine is found in mushrooms, but it's also found in soil bacteria. So the roots of plants will take it up and humans that eat the plants will get small amounts of ergo, and animals that eat the plants will get small amounts of ergo that will be transferred to their flesh. So when we eat animals, we also get ergo, but the best source of ergo comes directly from mushrooms. Mushrooms are the very best source for ergo, and almost every mushroom, even those little button mushrooms, has some ergo in it. The lion's mane happens to have larger amounts of ergo in it than most other mushrooms. Um, as I mentioned, not manufactured by mammals, but they've got the transporters, the receptors throughout the body, similar to glutathione, which is another antioxidant. And what's interesting about ergo is it has two different forms depending on what the acidity is of the local tissue. And in one form, it winds up being an antioxidant, scavenging free radicals, but in the other form, it protects proteins from damage by free radicals. So it really has it's a very potent supplement and found in mushrooms. You could also get it from the golden oyster mushroom is very rich in it. That's where real mushrooms gets their ergo that they purify and sell in their Ergo Plus. And I've put a lot of golden oyster, which has the ergothioneine in it, in the products we're going to be talking to you about a little later, because there's some new products that are on our new mushroom products that are on the website that I want to talk with you about because they're pretty cool and they're my design. So, oh, and here's another ergo study. So in this one with nematodes, C. elegans, and rats, they wanted to determine what were the pathways that defining its benefits. And the nematode showed improved stress resistance and reduced age-related biomarkers. And the aged rates rats had enhanced exercise endurance, muscle mass, and vascularization. And I don't know if you're seeing all these ads now for NAD, which supposedly is like the most magical molecule to give you more energy because NAD, as you can see here, works in the mitochondrion, which is the powerhouse that creates all the energy in this body. But NAD is created by the use of ergothioneine, which is one way that also contributes to longevity and health. So, so it's pretty cool stuff. Um, and Speaking about the microbiome, here was a study from Korea in which they added lion's mane to kibble, to dried pet food, which is probably the worst for the microbiome, and they were able to measure improvements in the microbiome in these aged dogs with that lion's mane, because the lion's mane is a prebiotic, and the lion's mane has beta glucans that help to regulate and it helps to reduce the bad bugs and increase the good bugs through the immune system. Okay, so I hope this is good information. So we've added some new things to the Well Pet Dispensary that can benefit your pet's longevity. And we have three new products that are a powder. I've got some examples here. I don't know if you can see it or not because I can't really see myself. But we have the Pet Defenders, which is what we called the old 5 Defenders, but we wanted to make it specific for pets. So we're calling it Pet Defenders. And we've got turkey tail, and we've got lion's mane. And what we've done is we blended these mushroom extracts with krill meal. And krill meal comes from those little plankton that live in the Antarctic Ocean, and they're tiny little organisms, but I mean they're like miniature little shrimp, but they're pretty much microscopic, but they're so potent with with their nutrition that they feed the largest animals on Earth. That's what whales eat. And so it's very tasty. It has great nutritional value in terms of having EPA and DHA, the fish oil types of fatty acids that are very anti-inflammatory. It has choline in it, and choline is a molecule that benefits the liver, benefits the nervous system, benefits the brain. We've used choline for cognitive issues before we learned about ergothioneine in pets. And we also have phospholipids in there, which help to improve the absorption of the EPA and DHA. And the krill eats a red algae called astaxanthin, which is the same name as this very potent antioxidant found in it. So in addition to having the great mushrooms in it, the five different mushrooms in Pet Defenders, the turkey tail, or the lion's mane, you've got a very potent value in the krill meal that are in these as well. They're very tasty. They come in 75-gram bottles, and we've got a bunch of inventory. We've ordered more because we know people are going to really use them. And then we have the daily wellness supplements, and just like these little containers here, we've got the daily dog and the and the functional feline, which also use krill meal as their base because it is so palatable and at the same time so healthy. But they have 8 mushrooms in each of them, smaller amounts than in these mushroom extracts, but they also have adaptogens and detoxicants and live probiotics as well. So my thought was that the daily dog or the functional feline, whether you've got a dog or cat, could provide a foundation of wellness. And of course, I've got the Ultra EFA, which is the RX Vitamins fish oil that we sell, which is a great source of EPA and DHA. But the krill meal itself in these mushroom products can provide almost as much EPA and DHA as the Ultra EFA. But my thought was to use the daily dog and the functional feline as a foundation, a wellness foundation. And then if your dog or cat needs, maybe some help with cognition, as in lion's mane, or maybe your dog has cancer, or you're worried about cancer, or something like that, we would then look at using turkey tail because it would help to improve immune system issues. Or, the Pet Defenders, that's got the reishi and the chaga, which have those terpenes in them, which are good as which reduce histamine release from mast cells, which are the allergy cells in the body. So I think by blending these two together, I think you can get a really good program for your pet and then adding to that the best quality food that you can. So these bundles that we'll be talking about a little later involve putting these together and getting a nice 25% discount for getting both of those. Um, and then we finally have gotten our poop together. And so we've got these diets now available, which you can order on our website. And then that sends a message to the company where they have everything, frozen and they'll ship it out to you frozen. And it's a great solution. These are really good companies. I've been feeding these to my own animals, and I'll tell you a little bit about each of them when I get to the next slide. Um, and they can be expensive, and maybe they're not something that you would feed every day, but it might be something that you might feed a couple times a week, maybe on the weekend. And then in the meantime, maybe do your own home prepared meal or use a commercial food that's less processed. And I was wondering if there's any interest in this group in my talking about my approach to home prepared meals, because I've been doing this for many years in practice. I was one of the first vets to do it. I've got a real simple way of doing it. It's not as complex or diverse as many of the diets that you'll hear out there by other holistic vets, but it's easy. And in my experience, having taught these diets for many years, that if you don't make it easy for the pet parent to do because life is awfully busy, they'll get they'll be excited about doing it for a little while, but then things will kind of trail off because it's just so hard to do. Sourcing all the materials, putting it all together. But there are some pet parents 2.0, for whom that's a great thing to do. And I certainly celebrate that 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 you want to get complicated with your healthy diets. And we can provide you with more complicated information as well. But home prepared meals can be a good way to kind of fit to give your pet the diet that it needs. And because you can't, because maybe you get tired of doing it every day, and maybe you freeze them and serve, and freeze them into individual serving portions that you can thaw out. There also comes a time when maybe you don't want to do it. Oh, I'm tired of doing this. Where you reach for the freezer and you thaw out one of these other diets that you know is going to be just as good. But we have a lot of supplements that you need to add to your home prepared meal in order to make sure that it's complete and balanced. Sources of calcium, sources of fatty acids, sources of micronutrients and things like that. So I certainly can cover this in a future Doc Rob Live, would love to, and share with you my approach to doing home prepared diets, which may be a little different than some of the things you heard. So when we talk about bundles, we're good when we allow you to mix and match any two qualifying formulas and save 25% automatically applied at checkout. So you don't have to worry about some code or anything like that. And like I mentioned, maybe start with a daily wellness foundation like the dog or the feline, and then use a more targeted support based on what your pet's needs are. Pet defenders, as I mentioned, for allergy and immune support. Lion's mane for cognition and behavior. And actually, I should have put here, lion's mane is also good for GI. Originally, lion's mane was used for GI problems until we were able to cultivate it in larger amounts. And then we started learning about its value for cognition and neurologic function. And then turkey tail for immune focused support. So we think this is a pretty good deal, and I hope you do too. And then our diets, we've had the Chi foods for a while, and these are based on Chinese energetics. We try to match the diet to the energetics of your dog. Maybe you've got a hot dog, and we want to feed the hot dog a colder food to cool it down, or we've got a cold dog, it's too cold, we want to feed it a hot food, or maybe it has a lot of inflammation, so we want to use a colder one, or it's each so and when you go to Chi Foods, it's very well defined for you as far as how to figure that out. And the company is ready to consult with you about figuring out which is the best of these 5 different diets for your dog or for your cat. Um, Evermore Pet Food is one of the tastiest foods around, and Um, I've known the owner. I know the owners of all four of these companies, and oftentimes we exhibit at the same conferences and things. So I've gotten to know them and kind of know them behind the scenes. So I really know, and that's one reason I chose these because I really think these are good quality foods. Evermore, the owner of Evermore, Hannah, she ate her own food for a month to prove that it's healthy and nutritious. Evermore is lightly cooked at 165 degrees to destroy foodborne pathogens, but not destroy the good nutrients in it. The Chi Dog is all frozen raw, but it's all human grade and very and they've not had any kinds of problems with bacterial contamination in that. Raised right is an interesting food. It was developed by Dr. Karen Becker, if you know her from Inside Scoop, but it was developed Karen and Barbara Royal from Chicago together. Both of them worked together on these formulas for Raised Right. It's a really good product. What was interesting about it, our cats were a little reluctant to just dive down and scarf it up um, because it's a little bit on the dry side. It's not dried, it's moist, but they've reduced the amount of moisture in it. So for one, you're not paying money to ship water weight, and you can always add bone meal to it or other, or raw goat's milk or fermented goat's milk to it to make it more liquid. But it also, you're not paying for all that water weight. So that's what I liked about it. I think they're very good foods. And then goodness gracious, that's what we're currently feeding. I love that name. They've all been formulated by expert nutritionists. And the goodness gracious is what we're feeding right now, along with some homemade stuff as well. And so you got lots of good choices here. And we make it easy for you. You go to the website and explore their foods and then order, through our own website and you'll get a discount and we get a little bit of a kickback for offering it to you. So everybody's happy. We don't have to keep it in inventory, which would be a pain because most of them are frozen and have to be shipped on ice or dry ice. What was really cool about goodness gracious is that not they're so totally sustainable that the cardboard boxes they use to ship the frozen meals, they instead of using like a styrofoam or something that's not recyclable, they actually stuffed straw in between. They had these opening walls. They stuffed straw into it as insulation. I thought that was really pretty cool. So this is I forgot I had this one coming next. So this kind of explains it to you. And these slides will be available to you, so it'll give you a good review of these. But the raw food formula to match TCVM, energetics, Evermore, gently cooked food, raised right, gently cooked food, right, developed by Dr. Becker and Dr. Royal, didn't get that in there. And then goodness gracious. So I think these are good choices. There are more diets out there, there just comes a limit as far as how much you want to do. So that brings us to this next part, which is Ask Me Anything. And let me stop my share and we'll get on with it.
Yeah, we have
Here we
some
are.
good questions tonight for sure.
Good.
So, first one, in keeping with a low toxin environment, do you have any suggestions for tick prevention and or finding ticks on a long-haired black dog? She lives in a suburban environment, no long grasses or forests.
Well, fortunately, it sounds like your environment is a fairly low tick kind of environment. Also depends on which part of the country you live in. There are some parts where ticks are much more prevalent than others. When I was in practice in Colorado, I almost always found that dogs that came from North Carolina that had problems had some evidence of a tick-borne infection, or from New England, Lyme's disease, which is another tick-borne infection. So there are pharmaceuticals that are used. And they're pretty much, they've got some tablets, but they're pretty much spot on drops as well. And some dogs, they work okay for many dogs, but some dogs have reactions to them, and some of them are pretty nasty reactions. So I can understand trying to avoid those if at all possible. And it sounds like you live in a decent situation where they're not going to be bringing them on board. So I think that the best way, the most non-toxic way to eliminate ticks is every day when you come inside, maybe at the end of the day, go over your dog with a fine tooth comb. If the hair is not super long, that's a lot easier. But if you can find the ticks before they embed, then that also prevents them from transmitting, if they have an infection in them, into your dog or into yourself. So removing a tick is not really that hard. You kind of need a tweezers or maybe a hemostat, and you just need to go all the way down to the skin where the head is biting into the skin, and grasp it as close to the skin as you can without pinching the skin, and then just gently remove it. You can put a little bit of alcohol on that wound or betadine. I've almost never seen those things get infected. Um, flush it down the toilet, step on it, burn it, whatever you want to do with the tick to maybe get your yayas out. Um, but that would be the very, very best non-toxic way. Now if you lived in a place, like in the woods in Virginia or North Carolina, it and you had a huge tick infestation, that might be a reason, during tick season to consider biting the bullet and trying the pharmaceutical. Because there's times and places for pharmaceuticals when our natural approaches are overwhelmed. So I'm not against them. What I do for my own dog, because last year we had, normally you don't have a lot of ticks here in Colorado. We had a really wet winter, and last spring we had quite a few, and Ollie picked up quite a few of them, and I kept trying to pick them off, but kept getting them, and he didn't like me picking them off either. So I did use a spot-on drop with him, and it's one that I'd used for years in my own practice, and it's a legacy product. All these newer pharmaceuticals, I think, are more likely to be toxic. So this is basically called frontline, and it doesn't have anything else in it except the frontline. And I did that for 1 month, and then I did that for another month, and he did fine. I think, if you're just using it for a month, the worst month of the year, two worst months of the year, I think it's not as bad as if you're using it every month and it's just building up in the body. I think that's when the liver gets a bit overwhelmed in terms of its ability to deal with it. Now, there are some dogs which are very, very sensitive to these. And if you have a dog that's uber sensitive, then that may not be the best of advice that I'm giving you. Okay, next question.
All right, next question. First, thank you for hosting these lives every month. I really do look forward to them. I'm looking to start Bruce Wayne's younger brothers on a daily mushroom supplement. Being that they have Bruce Wayne's DNA and may be already subjected to his health issues, would you recommend the pet defenders for them or the daily dog?
Well, I think the daily dog is a good place to start. They don't have active disease. They don't, I mean, Bruce has a non-contagious form of cancer. Most cancer is not contagious. So, and lightning strikes. Just because Bruce got it in your household doesn't mean they all will. So I personally would suggest the Daily Dog because it has the probiotics. It has 8 different mushrooms in it, and at nice levels that when you give them daily, that you're not treating something that needs to be a medical condition needs to be treated. I think that's really the best way to go. But at the same time, the Daily Dog and the Functional Feline are $10 more per bottle than the um, Pet Defenders with Krill Pet, which is $35. So that would not be a bad option to do. It just doesn't have all the other supplements in it. But you may already be giving those other supplements in other forms to your other animals. So that would be how I would differentiate between those two. Now, if the other dogs had some issues, then we might want to use both, together. And certainly it's a fairly decent, the bundles, I think, help to make things a little more reasonable over time. And your dogs are fairly small, which also makes them more reasonable. Um, but good to see you, Misha.
All right,
Good to not see you. Good to know you're here. I don't see where you are.
next question here. What can I do for my 14-year-old lab who has weak hind legs with decreasing muscle? Nutrition supplements, pain medicine, natural and over-the-counter mushrooms. She also has a very dry snout for the past year. I've done the pet store snout soother and DIY with coconut oil, and I've been unsuccessful.
Okay, well, those are a few things. Um, yeah, it'd be nice if we could somehow have these questions written out. It just helps, especially when they get more complicated, like, a couple of different things. We'll have to figure that one out. I think we had a little bit of that last time but we didn't quite enact that.
Yeah, I think the main issue is the decreasing muscle.
Yeah. So there's a number of things that can be helpful. And of course, one wonders what is causing that decreasing muscle mass. Is it a neurologic problem, in the spinal cord? Is it, arthritic in the hips or the spinal cord or knees that's causing the animal to be less active, less weight bearing, therefore the muscle mass is diminishing? Is it some other problem, like maybe a kidney issue where they're actually losing protein through the kidneys? So it gets a little bit challenging to just say, here, do this. This is why I gave that disclaimer at the beginning, because it is hard. So I'm very fond of acupuncture, and if you have veterinary acupuncture in your area, I think it's well worth trying that for older dogs, especially for weak hind end. It can be very good. It can be good for globally helping that dog. If we're looking at a mushroom for an older dog with rear end issues and possibly loss of muscle mass, I would look to the cordyceps mushroom as far as a single species of mushroom, um, because it's known for its ability to help with weak hind end, and also can help with kidney function and um, and muscling. So I would look at something like that. But I think the mushroom's not going to be enough as a standalone. You need to have a better diagnosis as far as what's causing these symptoms, so we have a better way of knowing exactly what to treat it with. Um, the dry nose oftentimes may be a hydration issue. It may have something more to do with the respiratory system. There's another single species mushroom out there called tremella, and tremella is known to help with hydration. It helps the body to retain more water. It's a very bland tasting mushroom. So you might want to use some cordyceps with some tremella for that, or possibly use a stronger topical for the nose. Maybe, more something like maybe something that has some shea oil in it, shea butter in it, or there are um, some strong things for hands to keep them from chapping. And so I don't have a nameable product for you for that. So those were three problems, right?
Mhm.
Okay. All right. Let's try the next one.
All right, next question. My female Boston Terrier had successful removal of a mast cell tumor in January of 2025. I read Dr. Silver's book and want to put her on one of his mushroom supplements in hopes of preventing another tumor. Would his mushroom immune soft chews help? Ideally, I think the turkey tail capsules are probably best, but my dog won't swallow capsules.
Well, you're in luck because now we have the turkey tail with krill pit, and the krill pit really blands out the taste of the turkey tail. So this way you can get more turkey tail in there. But instead of the turkey tail, my suggestion would be to go with the pet defenders or the five defenders, because they have the reishi in them and the chaga in them, which have terpenes in them that help to stabilize mast cell membranes, reduce histamine release, but also have a beneficial effect on the immune system. So you can get the pet defenders in the krill pet format. You can get the five defenders in capsule form. I think, well, now we're calling them pet defenders in capsule form as well. And those would be my suggestions for your boxer.
All right. My eldest senior greyhound will be 13 next month. He began slowing down and is having hind leg issues a couple years ago. Unfortunately, this is not uncommon in grays and is often described as they just get wobbly as they age. Do you have any suggestions? He has always been on a raw diet, gets homemade treats, yogurt, five defenders,
Astragalus.
astragalus, paw
Mhm.
paw, and homeopathy is needed.
Pawpaw, like the herb.
It's
Is that what?
PAWPA.
Okay, yeah, I think it's probably the herb. So you're getting your dog's getting the greyhound's getting a lot of good things. I would suggest acupuncture again. I don't know if there's acupuncturists everywhere, veterinary acupuncturists everywhere, but especially with a greyhound, athletes really respond well to acupuncture, and acupuncture can help both with the arthritic issue as well as with any kind of neurologic issue in that lower spine. So I know it's not something we provide, but you're already giving, I think some pretty good stuff. So I would look to something like acupuncture for that weak hind end. And it's fairly common in greyhounds. They get pretty thin, and especially if this is a retired racing greyhound from all their racing, there is a lot of damage down there at that hinge between the hips and the low lumbar, and there can be an interference with the nerve signals, which can cause that weakness. And that's why something that's interventional like acupuncture would be, in my opinion, the place I would start with. Supplements could be helpful, but acupuncture is really, and laser could also be helpful as well. But I really like acupuncture. It really works well.
All right, next question. I have a question about the silver bullet. We are currently giving it to Oscar, but he's still very anxious about car rides. Our vet recommended Nutracom. We are apprehensive if it will help or not, but are willing to try. The vet was concerned, however, that the silver bullet mixed with Nutracom would be too much. What are your thoughts?
Not too much. And this is from Lauren, right? Um, because she reached out to me just before. Um, so the Nutricom is a formula that I created for RX vitamins 10 years ago, 15 years ago, 20 years ago. Works really well. I took that formula and I put it into my mushroom relaxed chews. And so we've been recommending the mushroom relaxed chews in combination with CBD, and we've been finding a really profound effect in terms of the two together. So I don't see that there would be a problem with using the CBD, the silver bullet CBG formula, along with the Nutricom. I think it's a good mixture. Tell your veterinarian not to worry about it. I'm happy to chat with them if you'd like me to about the whole thing, but it's not too much. In fact, for Oscar, who you're having problems getting him to settle, it may be just enough. And I would say, don't just slam them with a huge amount of both to begin with. Work your way up. You've got a dose that you're already giving of the silver bullet, and then I would start with a lower dosage and work your way up. I don't remember Oscar's size, and the Nutricom comes in capsules, so I'd probably just start with a single capsule and your dosage of the silver bullet and observe and see how he does. And then that'll help to give you a better idea as far as dosing. And I'm happy to, advise you on that, Lauren, as you start using it.
All right, next question here. Is fish oil any different for animals as it is for humans?
Well, I think you're talking about products, and it depends on the product itself. Just because a product is for animals or just because a product is for humans and has fish oil in it doesn't mean it's any good. So you need to be able to look at the product, look at the label, maybe go to the company's website and see what information they have about the type of fish oil, because there's different types of fish oil. Um, there's different concentrations of fish oil, and fish oil is very delicate, so how it's stored, how it's preserved can create what we call lipid peroxidation, which is probably the most toxic of the free radicals that we were talking about earlier with the antioxidants. So technically, there doesn't need to be any difference between a fish oil for a human and a fish oil for an animal, other than the labeling on the bottle. The FDA doesn't want you to sell a product to different species. You can't label a bottle for humans and for animals. Like the silver bullet, it's all human grade. I take it myself, but I'd have to manufacture a whole nother line of silver bullets with a whole special label it's FDA compliant in order for me to sell that. So instead, I just tell people take that. So the Ultra EFA that we sell is a very good quality Norwegian fish oil. It's a good brand and it has a good preservatives in it, very low level of oxidation in it. Nordic Naturals as a brand is a really good brand, and they have both human and animal labeled products as well. Um, and krill meal as a source of the EPA and DHA, is a natural source. And because it hasn't been, and there is krill oil as well, but the krill meal is actually just the dried bodies of these little plankton. And so it's actually less likely to get oxidized than the oil itself, which has to be pressed and squeezed out, and then there's going to be some heat generated and some possible degradation of it. I think krill meal is a really good solution to the need for fish oil. And it has more than just the fish oil in it. It's got the choline, the phospholipids, and the astaxanthin. So I hope this answers your question.
All right, next question here. My puppy overheats internally. How can I help this? He is 8 months old.
I'm not quite sure what that means. I guess he's panting a lot. Don't know if you live in an environment where it is hot, and certainly things are warming up here in Colorado. Here in, just first couple days of spring, it was 87 degrees today. So I was panting too. So he's a puppy, and maybe he's panting a lot because maybe he's not hot. Maybe puppies pant, animals pant for a lot of reasons other than just being hot. It could be he has anxiety, from whatever. I don't know anything about it, but anxiety could be a cause for panting. It could be that there's something else going on. They also will pant when they have some painfulness. I don't know much about that. So it's harder for me to know what to recommend because I don't really know quite what is the source of that. You know, um, is there enough water? Is the puppy drinking enough water? Are there physical ways of cooling him off if you do live in a warm environment, like a little spritzy thing, or we've got a dog bed cover that's cool. I've seen some of those advertised. Um, I mean, that's a hard question to answer. I'm sorry they're not being more specific.
All right. Will you ever carry the larger bulk 150 gram real mushrooms, lion's mane, or turkey tail powder sizes?
Um, Probably not. And so there's no reason why you can't get them directly from real mushrooms. If you can't get, if we don't have something, real mushrooms is a great source. Sorry to capture your sales, but it's okay. Um, and they give you really good discounts and good subscription rates and things like that. So if you find that you are needing larger volumes, maybe you've got a larger dog, you've got more dogs, go to Real Mushrooms and get it there. Because I don't think you're the first person to ask about that, so there just hasn't been that kind of demand. And in order to put it into inventory, I've got to buy a certain amount, and then it might sit there for a long time if other people don't want it. So I have to be sensitive to my business model so that I can stay afloat. So go to Real Mushrooms, you'll get that, you get what you need there.
In trying to choose supplements, how much is too much in combination? I want to do the best I can. Do you need to worry about interactions or side effects?
So basically, not much. Okay. Most supplements are very compatible with each other. There really is, I keep hearing this over and over from people. I don't know who's putting this in your minds. Sorry. I think that it's veterinarians who don't believe that supplements are any good, and they're trying to put a little bit of fear in you about them. But in my use of supplements over the years, and when I started out, I really wasn't as knowledgeable as I was now. And my approach has always been to kind of dose them as high as you can. I know with herbal formulas, commonly you get better results when you give larger amounts, especially if you're dealing with a very nasty disease. So in most cases, you're not going to have problems when you use a lot of it or when you use them together. Um, I can't say never because I don't know, each animal has their own individuality and some supplements may actually not be good. There may be toxins in them or depending on where you're getting them or where they're manufactured. The pet supplement industry is really booming now. And I'm seeing a lot, I hang out on TikTok a bit and I'm seeing a lot of ads for stuff that just looks like crap. And I'm hearing a lot of bullshit out there about people saying, oh, this, got those lumps gone, just in 3 weeks, the lumps are gone. Sorry, folks, that's all bullshit, you know? And, and so you need to buyer beware, you need to be careful. And that's why what I'm doing, and hopefully you're trusting me a little bit. What I'm doing is curating and providing supplements that I know are safe, are effective, are low, not contaminated. And I know the supplements as well. And because I'm selling them to you, I'm available to answer your questions about is this too much? Is this going to have an interaction with this pharmaceutical I'm using? That sort of stuff. It's everybody wants to DIY their pet's health, and that's good up to a point. But you need to have somebody weigh in as well and provide some expertise, and that's what I'm here for.
All right, next question. How do you repair the digestive tract? My dog has mucus at the end of her poops and she scoots her bottom daily. She did list a bunch of supplements and things that the dog is on, if you want me to share that. But the main issue is, helping with mucus in her stools.
Okay, mucus in the stool, that's a sign of irritation in the colon. It could be that the number of supplements that you're using are enough to irritate that colon and cause that mucus, as compared to it being colitis, or it may be colitis that's being generated by the number of supplements. Or it could be colitis, or it could be a bit of food allergy that's being generated by the food that you're feeding. So, and the scooting in particular is a sign of anal glands because they've got those two little, glands just, on either side of the rectum. And there's the tail and then the brown eye that never sleeps. And every time the dog defecates, the anal sphincter squeezes down to pinch that loaf off, so to speak, pardon my French. And when it does that, the fluid that's in those little anal glands gets expressed and it comes out a little hole out of the gland and kind of coats the stool. So that's why you might see dogs sniffing stools and then sniffing each other's butts because the secretions in these glands are very specific. They're loaded with pheromones and they identify that dog. And so this is kind of like, when dogs are sniffing around, it's like they're reading a book. They're learning who's been in that neighborhood, who peed over here, who pooped over there. So when stools are a bit soft, and maybe the mucus in the stools are accompanied by some soft stools, then when they go to pinch that loaf off, you don't have that counter force of a harder stool passing through the rectum, and so the glands don't express. And if they don't express, the fluid which keeps being created builds up and builds up, and that little opening to the glands is continually being exposed to feces and to bacteria that could go retrograde up into the gland and cause it to be infected. And it can be very painful. Now, we also know that many times thickened anal gland secretions are secondary to food allergies. So what you're telling me is you're giving a lot of supplements, you're feeding some food, you've got some scooting, which could be due to food allergies, and you've got some mucus in your colon, which could also be due to food allergies or to irritation, even mechanical irritation from all the capsules or whatever you're doing. So what do you do? Well, I think I would start by going through your supplement list and weeding out everything except that which is absolutely important, or maybe stop them all and just do that and see what that does to the mucus in the stool. Then the next thing I would do in order to address the anal glands, other than expressing them, of course, and getting them empty, because the longer they're full like that, the more likely they are to get infected, and then that can cause an abscess and cause a lot of medical problems and costs, would be to do a food allergy panel in order to find out what the foods are that you're feeding that could